This paper, authored by Chorakutal RM, Chorbal RN, Pratap T, Arunachal MVK, Kumar SH, Bagri N, Gupta A, Chelajur A, and Nirmal MPK, was published in the Journal of Clinical Ultrasound in 2025. Chronic liver disease is a growing concern in India, affecting millions of adults each year. With lifestyle changes and increasing risk factors, early detection and prevention have become more important than ever. In this video, we explore a groundbreaking study that uses ultrasound shear wave elastography, or SWE, to assess liver health in an adult Asian Indian population. By leveraging advanced imaging technology, researchers aim to identify the prevalence of chronic liver disease and its associated risk factors, paving the way for better prevention and management strategies. Let's dive into the details and understand how this innovative approach is changing the landscape of liver health assessment. Preventive radiology is at the forefront of early disease detection, especially for chronic conditions like liver disease. The Indian Radiological and Imaging Association has initiated programs that use imaging-based biomarkers to screen for diseases before symptoms appear. By focusing on the liver, these programs aim to catch issues early, allowing for timely intervention and improved outcomes. Ultrasound imaging, particularly shear wave elastography, serves as the cornerstone of these efforts, providing a non-invasive, accessible, and reliable method to measure liver stiffness and detect early signs of fibrosis or other abnormalities. Liver disease is highly prevalent in India, with studies reporting rates ranging from 8.7% to nearly 50%. Non-alcoholic fatty liver disease, or NAFLD, is particularly common in both urban and rural populations. The high burden of liver disease has prompted the Indian government to integrate liver health into broader non-communicable disease strategies. Early identification and management are crucial, as liver disease often progresses silently until advanced stages. By focusing on liver health, preventive radiology clinics can help reduce the impact of this silent epidemic. Shear wave elastography, or SWE, is a cutting-edge ultrasound technique that measures liver stiffness. Unlike traditional methods, SWE is less dependent on the operator and provides objective, reproducible results. By sending mechanical waves through the liver tissue, SWE can detect changes in elasticity that indicate fibrosis or other liver abnormalities. This technology is not only cost-effective, but also widely accessible, making it ideal for large-scale screening programs in diverse populations. The study was conducted across 6 preventive radiology outpatient clinics in India, covering southern, western, and northern regions. Adults aged 18 and above who visited these clinics for abdominal or gastrointestinal assessments were eligible. After informed consent, participants underwent SWE to measure liver stiffness. The study included 1,145 individuals, with a majority being male. Detailed demographic, clinical, and lifestyle information was collected to analyze risk factors and disease prevalence. To guarantee accurate results, all SWE assessments were performed by experienced radiologists using standardized protocols. The Resona i9 ultrasound machine was used, equipped with advanced features for precise imaging. Quality indicators like the MSTB index and ILB map ensured that only high-quality images were included in the analysis. This rigorous approach minimized variability and enhanced the reliability of liver stiffness measurements across all study sites. Liver stiffness was graded according to international consensus guidelines. Values below 5 kPa indicated a high probability of normal liver, while values between 9 and 13 kPa suggested compensated advanced chronic liver disease, or CACLD. Readings above 13 kPa confirmed CACLD, and those over 17 kPa pointed to clinically significant portal hypertension, or CSBH. This grading system helps clinicians identify patients at risk and determine the need for further evaluation or intervention. The study population had a mean age of 45 years, with over 3/4 being male. Body mass index varied, with a significant proportion classified as overweight or obese. Common comorbidities included hypertension, diabetes, and dyslipidemia. These demographic and clinical characteristics reflect the broader trends seen in urban and semi-urban Indian populations, where lifestyle-related risk factors are on the rise. Lifestyle choices play a significant role in liver health. In this study, 20% to 50% of participants reported personal risk behaviors such as regular alcohol or tobacco use, lack of exercise, and frequent consumption of unhealthy foods. These behaviors are known to increase the risk of developing chronic liver disease, highlighting the importance of targeted health education and lifestyle interventions. The median liver stiffness measurement among participants was 8 kPa. About 10% had advanced chronic liver disease, while nearly 23% had values suggestive of CACLD. These findings indicate that a significant portion of the population is at risk for progressive liver disease, underscoring the need for early detection and intervention. The study also examined biochemical markers such as aspartate aminotransferase, AST, alanine aminotransferase, ALT, and fasting blood sugar, FBS. These markers tended to increase with higher liver stiffness grades, but the correlation was weak. This suggests that while biochemical tests provide useful information, they may not fully capture the structural changes in the liver detected by SWE. Several risk factors were significantly associated with advanced liver disease. These included hypertension, diabetes, ischemic heart disease, dyslipidemia, polycystic ovarian disease, regular alcohol and tobacco use, and lack of exercise. Both lean and obese body mass indices were linked to higher risk, emphasizing that liver disease can affect individuals across the BMI spectrum. One of the most important findings was the presence of modifiable risk factors in 20% to 50% of participants with liver stiffness between 7 and 13 kPa. This group represents a critical target for preventive strategies, as lifestyle changes and management of comorbidities can potentially reverse or halt disease progression. Let's look at an example of a normal liver stiffness measurement. In this ultrasound SWE image, the mean liver stiffness is 4.14 kPa, indicating a high probability of a healthy liver. The quality indicators, such as the 5 green stars on the MSTB index and a 100% ILB index, confirm the reliability of this measurement. In this next example, the liver stiffness is measured at 6.8 kPa. This value rules out compensated advanced chronic liver disease in the absence of clinical signs. Again, the image quality is confirmed by the 5 green stars and a perfect ILB index, ensuring confidence in the result. Here, the liver stiffness is 9.56 kPa, which is suggestive of compensated advanced chronic liver disease. This finding warrants further investigation to confirm the diagnosis and assess the need for intervention. The image quality remains high, supporting the accuracy of the measurement. Liver stiffness value of 13.48 kPa confirms the presence of compensated advanced chronic liver disease. At this stage, timely intervention is crucial to prevent further progression. The SWE image, with its quality indicators, provides a reliable basis for clinical decision-making. In cases where liver stiffness exceeds 17 kPa, as seen in this example with a value of 17.84 kPa, clinically significant portal hypertension is likely. This advanced stage requires specialized management and highlights the importance of early detection through SWE. The study identified 2 key subgroups, those with liver stiffness between 7 and 9 kPa and those between 9 and 13 kPa. The first group represents individuals in the 50th to 90th percentile, where lifestyle interventions can still reverse or halt disease progression. The second group, above the 90th percentile, requires further testing and close monitoring to prevent deterioration. There is strong evidence that lifestyle changes, such as reducing alcohol and tobacco use, increasing physical activity, and managing weight, can reverse early stages of liver disease. The presence of modifiable risk factors in a large portion of the at-risk population underscores the potential for prevention and health improvement through education and support. Ultrasound SWE provides an objective framework for tracking liver health over time. By regularly measuring liver stiffness, clinicians can monitor the effectiveness of interventions and detect any worsening of disease early. This approach supports personalized care and better long-term outcomes for patients. Blood tests like AST, ALT, and FBS are useful. They do not always reflect the structural integrity of the liver. The study found only a weak correlation between these markers and liver stiffness, highlighting the added value of imaging-based assessments like SWE for comprehensive liver health evaluation. Interestingly, both lean and obese individuals were found to be at increased risk for chronic liver disease. This U-shaped relationship means that screening should not be limited to those who are overweight. Even those with low BMI may benefit from liver health assessments, especially in populations vulnerable to undernutrition. The study faced several challenges, including reliance on self-reported risk factors, potential underreporting of unhealthy behaviors, and a predominance of male participants. Additionally, the outpatient clinic setting may not fully represent the general population. Despite these limitations, the findings provide valuable insights for designing targeted prevention programs. Different elastography techniques, such as vibration-controlled transient elastography, VCTE, point SWE, and 2D SWE, can yield varying results. The study used a consistent ultrasound system for all participants, but it's important to note that measurements may differ across devices. Ongoing research is comparing these methods to determine the most accurate and practical approach for liver disease assessment. The results of this study have significant implications for public health in India. By identifying at-risk individuals through non-invasive imaging, healthcare providers can implement targeted interventions to reduce the burden of chronic liver disease. Integrating SWE into routine screening programs could transform liver health management on a national scale. Looking ahead, further research is needed to refine risk prediction models, optimize screening intervals, and evaluate the long-term impact of lifestyle interventions. Advances in imaging technology and data analysis will continue to enhance our understanding of liver disease and improve patient outcomes. For clinicians, the key takeaway is the value of integrating ultrasound SWE into routine practice for early detection and monitoring of chronic liver disease. By combining imaging with clinical and lifestyle data, healthcare providers can offer personalized care and support patients in making meaningful lifestyle changes. Empowering patients with knowledge about their liver health and risk factors is essential. Through education and regular screening, individuals can take proactive steps to protect their liver and overall well-being. Preventive radiology clinics play a vital role in this process, offering accessible and effective tools for disease prevention. In summary, ultrasound shear wave elastography offers a powerful, non-invasive method for assessing liver health in Indian adults. By identifying those at risk and highlighting modifiable factors, this approach supports the development of targeted prevention strategies. As research continues, integrating SWE into routine care could significantly reduce the burden of chronic liver disease and improve health outcomes for millions.